Cases of COVID-19 are on the rise here in Ohio, with students heading back to school. One local doctor is telling parents to be aware of this uptick in cases.
Our Candace Hare joins us live. And Candace, what should parents be looking for?
Yes, good morning, Dave, Danita. Well, I can tell you that more than 7,000 cases of COVID-19 were reported in Ohio last week, and state data shows that is roughly 600 more cases than the week before. Among those recent cases, that includes Governor Mike DeWine, who announced that he recently tested positive for COVID-19. But one local doctor, she tells 3 News that she thinks this case rate could go even higher, and that's because of the timing, as we have many kids making their way back to school. When it comes to symptoms, Dr. Amy Edwards tells us to look out for things like a sore throat or a fever, and her recommendations for families, especially those with young kids, would be to practice good hygiene, wash your hands, sneeze into your arm, and use hand sanitizer. And if you're able to do so, she also recommends wearing a mask and using antigen tests.
Those tests specifically for the viral proteins, not just PCR, which tests for genetic material. And if the virus is making proteins, then it's still replicating in your body, meaning you're still contagious.
One thing I can tell you coming through the state data is that hospitalizations here in Ohio, they are up as well. And even though this peak, it's nowhere near what we saw over the past couple of years when it comes to those hospitalizations from COVID-19, it is worth just reminding ourselves that this is something that can be serious or even deadly. Back to you.
Definitely got to be mindful of it. Okay, Candace, thank you.